People do not want to talk about their brain and their brain function. They get offended if you bring it up.
Because we think about cognition and thinking as one big lump thing, but there's actually different domains, there's different types.
How do we know if the signs that we're seeing are concerning?
Those blood vessels are everywhere. So it's not just in our heart and our legs, also feeding our brain.
These are
Mm-hmm.
very practical ways in which we can manage our brain health.
Never too early to think about brain health.
It's a fog that's kind of like your why did I come into the kitchen again?
We are less likely to be diagnosed. When we are diagnosed or diagnosed later, what we actually term as pseudo dementia, which
Mhm.
is, mood symptoms that can actually look very similar.
Stop on that point right there. Brain health is something most people don't think about from day to day, but as we age becomes one of the most concerning parts of our health. Science has taught us that from our thoughts to our lifestyle have impact on our brain health. As women, we experience multiple life transitions that also have impact on our brain function, from pregnancy to menstrual related changes. Today, with our expert panelists, we discuss how to optimize brain health and how to know when there are warning signs and how to support those impacted by neurodegenerative disorders. We thank you guys for watching, and as always, don't forget to do what? Click subscribe. I am so excited today. Now, if you are like me, I'm sure you are seeing tons of information about brain health when it comes to pregnancy, menopausal symptoms as we age. And so I'm so excited today that we have Dr. Jennifer Adrissi, the couch with us. Today, she's assistant professor of neurology at UCLA and director of the Parkinson's C.O.R.E Collaborative. I am so excited to have you on the couch today because I have lots of questions to ask.
Hopefully, I can answer some of those. But thank you so much for having me, Dr. Moore. I really appreciate it.
Thank you for joining us. So, before we get started, sometimes we're a little curious as to how women of color end up in the fields that we end up in. So, what attracted you to neurology?
Yeah, so I will say initially, I didn't think that I was going to go into neurology. And I think that was probably because of just lack of exposure, right? Growing up, the people who we see are pediatrician, maybe family doctor. But as I went through my clinical rotations in medical school, I was like, okay, there's something interesting here. I really enjoyed sort of the putting the pieces of the puzzle together, right? Like some of
Hmm.
the neurological exam matched with the conversations with people with these conditions and their family members, and then just yeah, I like to create long-term relationships with people, so I'm able to do that in a specialized fashion and try to get people plugged into the resources and the management that can help them live a fuller life.
Well, we certainly need your specialty. Listen, there's lots of things going on. So there's lots of attention, as I mentioned, to brain health, right? And people in general, I feel from my perspective, you let me know if your experience has been different, seem to be paying more attention to brain health and understanding how our brain works and how do we optimize our brain health. When is the right time for us to start to pay attention to brain health? A lot of times we're thinking of brain health as we get older. Is this
Mhm.
something we should pay attention to when we're younger?
Yes and yes. So it's never too early to think about brain health and how you're really just trying to lift your baseline is what I kind of tell people, because we get to a point sometimes where people have issues with their cognition and their thinking, but things are
Hmm.
usually cumulative, right? And so that 10 years of smoking that someone did early on that affected those blood vessels, or the high blood pressure that may or may not be controlled, different diet changes, exercising or lack thereof. All of these things together actually build on each other, right? Until we pass that threshold where it's like, okay, the brain is feeling, enough of this wear and tear mixed with sort
Hmm.
of genetic, predisposition, or kind of what makes one person more likely than another to develop dementia or things like that. So yeah, it's never too early. One of the other things that I really try to recommend is just try to keep your body and your mind as active as possible. And there's no bad time to start with that. When you think about people who do well longer for their
Hmm.
cognition, it's usually those who were, mentally active, whether that means higher levels of education or, more kind of mentally stimulating jobs. But we can do other things, right? Like if you have a curiosity about trying a new language, things like that. All of these things are protective factors, if you will.
So a lot of us, especially now that we know we're living longer, more
Mm-hmm.
people, we're seeing more centenarians all the time, 90-year-olds all the time, and a lot of people want to age well. When
Yeah.
it comes to the brain, you mentioned activities that are stimulating that keeps our brain active. So, especially when we're retired, that's usually when life starts to slow down. How do we continue to keep our brains active even as we are in our retirement age?
That is an excellent question, and one that comes up often personally as well as professionally. And I always say that, that's where the planning starts. So before people retire and when they're getting really excited for retirement, my first thing is usually congratulations, right? Because this is a milestone that, some people actually don't make it to. And so
Right.
really kind of leaning into that, like, we
That
are
part.
living longer.
Hmm.
So, and to have the privilege to retire, like that's amazing. But or and we also have to have a
Uh-huh.
plan.
Hmm.
Because I know I was just talking with my father the other day and just talking about, different conversations that he's having with his peers, right? About, people who retired and, what their health looked like after that, right? Or different
Right.
unexpected things. And so how can we prevent that? And I think it's having a plan. And so we underestimate sometimes how much our body and our mind are moving when we're actually employed and working, for better or for
Hmm.
worse, right? But
Hmm.
we're usually moving a bit more. Our mind is more active. We're having more conversations, more mental stimulation. And so when someone's planning for retirement, I often ask, like, what do you enjoy? What does your community look like? How much of your community is tied up into your employment, and how will that change once you're not, with these same people every day?
Right.
And so that might be leaning more into certain social groups that they already have, whether it's a church. Churches are often great places because they have lots of programs, whether it's like volunteering during the week, things like that, plugging into different senior centers or just community centers. Some people do some volunteering. And so just kind of having a plan of what am I going to do with my time, right? Because it
Hmm.
helps your body, one, and then also your mind, and also decreases isolation. So those are
Yeah,
the
I
main things.
remember reading not that long ago, which I thought was really interesting. Trying to remember where I read it. And it was basically talking about even our exercising, that to choose activities that make you think, that
Yeah.
make you process, and as opposed to activities that are kind of repetitive, but activities that make you process information and sometimes challenging yourself to even do higher cognitive function while you're
Mm-hmm.
exercising. So whether it's, adding something, multiplying something as you're dribbling a ball, as you're throwing something, that those are ways to really maximize or optimize your brain health. There is a concept about pregnancy. So a lot of my moms are always talking about their pregnancy brain. And
Mm-hmm.
now I have entered the perimenopausal fog
Yeah.
that exists. So when it comes up sometimes, are these indicative of our long-term brain health? Are is it the more foggy you are as a mom and the more foggy you are as you transition into menopause, which it seems like women are always transitioning into something? Um,
Something. It's
does
not
this
one thing,
are
it's
women
another.
right,
What my
right,
mom always
exactly. Are women more likely to have movement disorders, cognitive issues as we get older because we're so foggy in these transitions?
Also a very needed area of research. Historically, men were really the main people who were studied how their bodies work, how their brains work, how their minds work, things like that.
Right.
And so their women were very much excluded initially, and then just kind of undersampled and under recruited. And that's not even accounting for race racial and ethnic minority groups, right? So Black
Mm-hmm.
folks, brown folks. And so when we're thinking about women in these different changes, so one thing is during pregnancy, right? That brain fog. I have to have a 3-year-old and a 1-year-old, and so I know this personally as well.
Right.
A lot of our body's energy, our blood supply, things like that are going to the baby, right?
Right.
And so, a lot of people feel like even physically feel like I feel more lightheaded. I feel like all of the resources are just kind of going to the baby. And so that's a piece of it and sort of the metabolic demand, if you will. There's
Mm-hmm.
also a lot of research going on about estrogen and the changes of estrogen and how that affects cognition. I'm really interested in looking into that more, especially as we're starting to talk more recently. I'm hearing more and more in the media about perimenopause and menopause, right? And like, what are these changes?
Right.
Because Lord willing, we all get there, right? And when we
Right.
don't get there,
Right.
that means that we did live to it.
Right.
And so this is something that we're all experiencing, but there's not enough research about it. And so we do know that estrogen to a point is neuroprotective. And
Mm-hmm.
so as our estrogen level is going down, especially during the perimenopause and menopause time period, people do have a bit of that brain fog. And so brain fog and just um, it's a different type of cognitive symptoms usually than when people are having sort of like a early dementia, mild cognitive impairment. Like you're able
Right.
to function, right?
I'm
It,
glad you
it
made that distinction
yeah,
because they have found that we're still very productive. So don't count
still
us
very
out.
productive, still highly productive.
Right. It's a
Uh,
fog that's kind of like your why did I come into the kitchen again? As
yeah,
opposed to doing things that are part of our daily work. So I'm glad you made that
yes.
distinction between the two.
And usually, when I talk to women who are having these symptoms, it's not affecting their performance necessarily, right? No
Right.
one's coming to them and saying like I'm concerned, but they feel it, right? They're
Yes.
like, oh, what's that word, right? Because at this
Right.
point, when you're thinking about it, a lot of women at this stage, it's almost like a nice age. Some of the kids are out of the house, right? They're now seniors sometimes in their companies or
Mm-hmm.
wherever. And
Yes.
they have a position of leadership, and so now
Right.
they're in front of all these people, and they're just like, wait, what's that word? Or wait, where did I put that? Or I know
And
we
I know
talked
your
about this
name.
yesterday.
I know
I
your
know your
name.
name, and it
Right.
can become extremely frustrating.
Mm-hmm. Mm-hmm.
And so we are finding out that this does have a lot to do with these decreasing estrogen levels. And now the question is one, to just kind of learn a little bit more about what is that connection, because we do know as well that women suffer from Alzheimer's disease more than men, right? So 2/3 of people
Right.
with Alzheimer's disease are women. And so we do know that women live a little bit longer than men, so that accounts for some, but not all of this difference. And so what we're trying to figure
Oh,
out
oh, oh, oh.
now,
Wait, wait.
oh, oh,
Dr. Dreesy, stop on that point right there.
okay. I was
Because
like, did I break
be,
up? I know for the
no,
second,
no,
like, shoot.
no, because that was an excellent clarification, right? Because we
Mm.
oftentimes this is why we need researchers on it to talk to us to help us understand the interpretation of these outcomes so we don't run with it and drive ourselves crazy. But you're right. The fact that we're living longer make what I'm understanding you saying it increases the likelihood that we're able to diagnose Alzheimer's because women are living longer. And so we're
Right.
more likely to encounter these cognitive issues. Is that what I'm
Yeah.
understanding?
Yes, but it also like the basically the numbers of years that we live longer than men still doesn't account for how much more we get
Mm,
Alzheimer's disease. So
I
we
gotcha.
know that there are other factors at play there. And I think one interesting one is estrogen. I'm kind of thinking, what does the role of decreasing estrogen sort of protecting the brain, that level going down, what does that do to our brain and our risk, et cetera? And how do we
Right.
modify that? And so we are learning and treating that a bit more now.
Mm,
So we have the comprehensive menopause program at UCLA, which is a combination of gynecologists, cardiologists, there's some bone health folks there, and then neurologists. And so Dr. Rhonda Bosco is actually the initial neurologist who's working, and I just actually started, we'll be starting this fall working in that clinic, the cognitive neurology clinic, specifically in the perimenopause, menopause program, where we're just kind of screening these women, right? Because a lot of times they're not listened to. They're like, oh, you're fine. You're just, going through the change. Don't worry about it. This is normal. But it's like this isn't normal, right? Like is there something to do? And then also there's always the question, is this menopause related, or is this something else that I should be worried about? Especially right now, as the research is actually progressing as it relates to Alzheimer's disease and related dementias, and some of these very new FDA approved medications trying to slow down the course of it. It's approved just in very early stages, like mild cognitive impairment. So how do we catch those people and differentiate that from menopause types of brain changes? So we're working on that. Also prescribing some different types of estrogen sometimes to help and see if it helps with people's brain fog. Of course, balancing some of the side effects and the risks and making sure that people are a good candidate. But yes, lots to do.
Yeah, and as you said, lots of room for more research on this and better understanding of this. You touched on something that that reminds me of, just even on a personal level, people who are concerned about family members who may be starting to show some signs of cognitive impairment, but they're not quite sure if they are seeing signs, and there's oftentimes some hesitancy to intervene or to even bring the topic up. One, how do we know if the signs that we're seeing are concerning? Like, what is that red flag that we should be looking for? And as a family member, if you're starting to see things that are kind of raising your eyebrow a little bit, how do we then even approach that topic? Because this is a very sensitive area, right?
It is.
People do not want to talk about their brain and their brain function. They get offended if you bring it up, because sometimes we confuse brain function and cognitive function with psychiatric illnesses and things like that. So if you can clear the air up for us regarding these things, so that we know when to intervene and how to approach the topic with our loved ones.
One thing that's really important is remembering someone's baseline, like what's their usual, right? And so one person's normal functioning may not be another person's. And so sometimes this gets tricky when someone is very busy. They, might have had a lot of schooling. They are, called an engineer, whatever, right? Or they're running their own bakery and they're functioning at here.
Right.
And then, people are noticing, they're a little bit off. Like this is maybe most people's 100%, but like this isn't normal for them. And I think like really trying to look for examples of things, because there's denial. Denial is a big part of, and it's normal, right? Not just denial from the person going through it, but also from family and loved ones, right? So when they're noticing things, sometimes it's scary. And so you might even have family members who are like, no, that's all right. That happens. That's normal. And so I think, really starting to take note of examples, because when people say, things are a little bit off, they might not know what to do with that. Or they're like, oh, I feel like they get lost driving somewhere, that they always go to, this bakery every Sunday and they got lost. Right. And then that happened twice. They also forgot their grandchild's name and it didn't come back to them. Right. Or, I had a conversation with her. I talk to her every week. Like this time it was just really hard for her to find her words, and they just weren't coming to her, and she would get confused easily. Things like that, and kind of starting to write things down. One, it's not only helpful for the person who wants to bring it up, right? It'll also be helpful in the future for a medical provider, right? To see like, okay, these are some of the things, because we think about cognition and thinking as one big lump thing, but there's actually different domains. There's different types of of cognition. And so
Mm-hmm.
I think that's one thing because, even if you are feeling like in denial yourself about a loved one going through something, when you're starting to write down and look like, okay, these things have happened now, this, 6 months ago, would this have happened? No. And then also kind of, talking with other friends and family that you trust, right? You don't want to put their
Mm-hmm.
business all over the place, but those
Right.
who they would trust,
Mm-hmm.
um, talking to them and seeing what they're noticing can be
Mm-hmm.
helpful. And then also, I think whenever approaching someone, coming to the conversation really more with curiosity or like just questions, like how are you
Mm-hmm.
doing?
Mm-hmm.
How is, if they're on some type of group or committee, how's that going? Just kind of
Mm-hmm.
having them talk about it because sometimes people actually bring up some of their concerns and some of their difficulties before you have to bring it up, I guess. And it
Right.
makes it just an
Right.
easier conversation.
Mm-hmm.
Um, so those things can be a helpful start to it.
Mm-hmm.
Also, I think it's really important to point out that all cognitive and thinking issues aren't dementia, right? And so, um, and there are some things that are treatable or modifiable or addressable, and so it's important, right? So there are our vitamin B, our B complex, especially like vitamin B12. I'm in California, so there's a lot of people who are vegetarian and vegan. I wish I
Yes.
could, it's nice.
Right.
But yeah, so from a lot of our meats, we get our vitamin B12, right? Also, there's certain, leafy greens and things like that that you can get it. But there
Mm-hmm.
are ways to get deficient in these vitamins that are also very, important for our cognition that can be just screened by our primary care doctor if you bring it
Okay.
up. Also,
Okay.
like our thyroid levels and making sure that the thyroid is okay. And so, I think when bringing up these concerns, like also having that, because people are usually more likely to share and talk to it with a doctor, kind of knowing that, hey, we need to make sure that there's not just a supplement that we can give you or a thyroid
Right.
medication. If
Yeah.
not, then we'll cross that bridge when we get there, but we want to make
Mm-hmm.
sure that we're not missing that.
I'm glad you brought up the fact also that there are other causes of cognitive changes that may not. So sometimes I have noticed with my own patients that when they're depressed, that their brain
Yeah.
function also changes. They have difficulty
Hmm.
focusing. They don't get as much rest and sleep, and a lot of times mood disorders and cognitive disorders get a little bit confused
Yeah.
to the public. How do we distinguish the two?
Yeah. So I'll kind of address this in two parts. One, the difference between brain health and mental health, right? And there's definitely overlap, but they're two kind of separate buckets that I like to bridge out for people. And then really talking a little bit about these cognitive or kind of thinking changes, what we actually term as pseudo dementia, which
Mm-hmm.
is, mood symptoms that can actually look very similar. So sometimes in the clinic space, I can't always tell, right? If someone is just severely depressed versus this is dementia. Um, Usually that's teased out with one treating the mood symptoms, whether it is through, psychotherapy and talk therapy or combination of medications, and getting that under control and then kind of seeing what's left, what symptoms are left. Also, it's important to know that there are certain resources and tests that are available. So there's neuropsychological testing, which really incorporates some cognitive and as well as sort of kind of mood symptoms together and pretty in-depth testing is about 3 to 4 hours.
Mm-hmm.
But that is something that can possibly be available to you. And so getting back to brain health versus mental health. And so there is definitely overlap, but when you hear people talking about brain health, usually what we're talking about is like the meat of the brain itself. And um, so our brain is, tissue. It has different blood vessels, just like everywhere else. That's blood vessels send blood to the brain. We have our brain there. And so as we get older, our brain shrinks a little bit over time. So cells in our brain, kind of shrink over time as we get older, comes with the territory. But there are certain conditions that are called neurodegenerative conditions, which basically is just a fancy word saying that these brain cells and areas of the brain are dying quicker than they're supposed to for your age. Those can cause like quicker shrinking of certain areas of the brain. So the most common one, and the one that most of the people have heard about the most, is Alzheimer's disease. The second one is actually Parkinson's disease, where I do a lot of my work in. And so that's sort of like the brain itself. The brain is also affected by other things. So plaque in our blood vessels that are caused by like high cholesterol, diabetes, high blood pressure, obesity, things like that. Those blood vessels are everywhere. So it's not just in our heart and our legs, also feeding our brain. And so when we have plaque in those blood vessels, the blood and that oxygen doesn't get through smoothly. So that can actually cause damage to the meat of our brain. Alcohol can cause damage to the meat of our brain. Same thing about smoking. When we're talking about mental health, while there are certain sort of imaging scans that can look at sort of the communication of different areas of the brain, right, that can be affected by mental health disorders, like depression, anxiety, ADHD, etc. Mental health is usually you kind of talk about it as like the mind, right? Like how we, are interacting with our environment. But, and I also say, while we can't always just look at an MRI of the brain and say, oh, there's the depression, there's the anxiety. We do know that has a big part of our genes, so our genetic makeup, that makes certain people more likely than other people to have some of these disorders. And when we talk about brain health and even mental health, it's not just the negative, right? It's not just having a disorder. It's also promoting the health of it. How do we create, a healthy brain, and promote our brain health? And that's by, exercising our brain, keeping it active, keeping, leaning on community, reading, whatever you do, kind of just keeping that going, and then protecting our cardiovascular health, making sure that those conditions are treated. And then mental health, making sure that you're, taking care of yourself, whatever that means for you, getting the rest. And I know a lot of these things are easier said than done, but yeah, I just want to say, make sure that we promote the good stuff as well.
Right. That self-care, in however you define it, does apply to preserving and optimizing your brain health as well. And thank you for all those modifiable things that we can do, because sometimes we kind of feel like if our genetics say that this is our outcome, that we have no other choice, that's the direction we're going in. But the truth of the matter is there's so many things that we can do to really either decrease the likelihood or optimize just how healthy our brains are, whether it's controlling our chronic illnesses, whether it's making sure that we have nutritious diets, whether it's also avoiding toxic habits like smoking and drinking. These are very practical ways in which we can manage our brain health. One of the things you mentioned early is the lack or limited research that's available to evaluate some of these symptoms specific to women. But you also mentioned that there is a challenge with representation when it comes to race and ethnicity. So as a researcher, how are you changing that dynamic?
Yes, definitely. So that is really my specific area of research. And so what I really do, I partner with the community. So I'm a neurologist, I'm clinical, but then I also do research, mainly in neurodegenerative disorders, Parkinson's disease, and then a little bit of Alzheimer's disease and Lewy body dementia. And what I do is we partner with the community, who are really the true community experts, right? And we develop interventions and different programs to increase access. So access to knowledge, right? Knowledge on how to promote brain health, knowledge on, where do you go? What do I do if I have these concerns? But then also resources. So access to specialized clinical care, as well as research opportunities. And so I talked about how we are significantly underrepresented, and that, that doesn't come without a cost. So, speaking about Black people in particular, so Black and Hispanic people are more likely to have Alzheimer's disease, but we know very little about them just due to the, very small chunk.
Mm-hmm.
And it's of no fault to the community, right? We need to figure out the science of recruitment and engagement of these groups, and really, continuing the conversation about what works best, and not ignoring past and current, injustices that have come from the medical and scientific field. Like, how do we right that? How do we
Right.
build healthy relationships with the
Right.
community, and go from there? Because I think that's the big piece, right? Like, if I don't know you from anybody else, I'm like, hey, you want
Right.
to, be involved in this study? Like, first of all, who are you?
Right. Two organs we
Why are
don't
you
play with, the
here? What
heart
do
and the
you
brain.
want? Exactly, exactly. And so that's what we really do. We try to develop programs where, one, they're kind of longitudinal relationships where you're not just popping in and popping out, but we have
Mm-hmm.
community partners that work with us to figure out the best way to engage and maintain these relationships. And then also trying to tailor what the resources look like, and sort of what the access points look like, and
Mm-hmm.
how we recruit, and how we do that better and more ethically. So that's my work. So I'm the director of the Parkinson's C.O.R.E collaborative, where C.O.R.E is an acronym for community building, outreach, research, and education. And so those pillars are basically what
Love
we
it.
stand on, and really helps direct our work. And so our overall goal is to decrease the disparities in neurodegenerative disorders, starting with Parkinson's and some Alzheimer's disease, and then expanding. Because we know that, we are less likely to be diagnosed when we are diagnosed, or diagnosed later. And all of those
Mm-hmm.
things have implications, right? Have
Right.
implications on the options that we have, medication
Uh-huh.
wise, research opportunities, but then also just like real life planning, right? And so there are
Mm-hmm.
different things like you can get insurance to kind of help you with your care later in life, right? That you would pay for earlier on, or your family might look into
Right.
if they knew that you had these disorders. And then there's more information, more genetic information coming out
Mm-hmm.
from the research that helps us kind of figure out where our risk is. And so there are certain genetic mutations that increase our risk of getting these disorders. And so now we need to start, learning, okay, well, you're learning about all these mutations, but you didn't really research a lot of people who look like me. And now we're building out these medications based on these mutations. And so we just really need more engagement. For one example, ApoE4 is
Mm-hmm.
one of the risk factor genes in Alzheimer's disease. And what we're learning right now is in Black people, it actually doesn't, that genetic risk doesn't weigh as much. And so there's just so much more
Oh, that's
that we
interesting.
have. Yeah.
Mm-hmm.
So we have a lot that we're learning, and it's an exciting time to be in neurology and to be in
Mm-hmm.
neurodegenerative disorders, just because the
Yeah.
research is moving. The research is
Mm.
moving. And so I just want to make sure that we are at the table and being accounted for and being incorporated into these findings in the next steps for us.
And how have we been responding as a community? Do you find that there's more engagement? Are we still a little nervous about these disorders? And I think also for the
Yeah.
community, it's also what you touch on, like the resources, because we know if someone has a particular diagnosis, then they're going to need more resources. And if we're living from paycheck to paycheck, that can feel quite daunting.
Yes, no, that's a great point. And I think, a lot of the onus is back on the academic institutions, right? I think sometimes what happens are assumptions, right? Assumptions that people aren't going to be interested, right?
Mm-hmm.
Or it's like, where are we promoting some of these research studies? That's
Right.
for us, we're
Right.
in, an area of Westwood and
You got to meet
Los
us where we
Angeles, or
are.
so it's like, if a lot of people are going in that traffic. If they don't live in that Westwood area, which has its own demographic, um, they may not they may not have access in that same way. And so I think so people, to get to your question, I think people are actually
Mm-hmm.
really receptive and really interested. the main feedback that I always get is, well, nobody asked me.
Right.
And what a shame that is. And so
Mm-hmm.
what we're really trying to also figure out is, how do we bring resources and research to the community and not expect people to come to see us and to meet
Right.
us.
Mm-hmm.
And so really trying to rethink our structures and rethink our approaches is, in a scientific way, is essentially what me and like my lab are trying to do. And so trying to be that bridge, if you will,
Mm-hmm.
between the community and the historic sort of research infrastructure, so we can figure out, one, what are the questions that, you know, that mean the most to us? Like, what do our people actually want to be researched, right? And creating these questions with them in mind. And then as we are kind of rolling out different programs and research studies, how do we engage people in a meaningful way? So it's been great. The projects and the research things that I always do, they're community partners. So I usually have some type of advisory committee or board who's working with me, which is always helpful to do from the beginning and not just ask people after the fact. And so it's been very well received. Kind of doing research, outreach, and education all at the same time while building community. So it's been good. It's been, just such a blessing for me to be able to incorporate all these areas of interest and passion into my career and say, this is what I'm
It's
able to
wonderful.
do.
And it's exciting.
So
It's exciting to know not only do we have someone who looks like us and represents our issues, our concerns, and understand our lifestyle, but it's also motivated to make us a part of the conversation, to study, to give us feedback, to bring resources to our community. It's really, to our communities, it's really encouraging to hear what you're doing. I'm so excited. And if someone wanted to get in contact with you, wanted to support what you're doing, or perhaps collaborate with you, how can they reach out to you?
Yes, definitely. So multiple ways. One, we have a website. So parkinsonscore.org. And so I can put that in the show notes. We're also on Instagram and Facebook. So Instagram, me personally, is Adrissi MD. And then the Parkinson's Core is at Parkinsons_core. And yeah, Facebook, Parkinson's Core Collaborative. Those are all different ways. And then through the website, you can also send us an email and we can start collaborating there. But this has just been amazing, and I want these conversations to continue.
Yes,
so
absolutely.
Hopefully, there's someone listening who wants to continue the conversation.
Absolutely.
Yeah,
Listen,
very, very privileged to be on here. Thanks so much.
Thank you for joining. I have tons more questions for you, but since I can't keep you all here all day long, I'm glad that you provided those resources where people can continue to learn and to kind of glean from your knowledge and your experience, and be able to get in touch with you. And y'all, please don't crowd her appointments slot. She can't treat everybody.
No, but yeah, definitely, send us a message. And, one of the things that we're also trying to do, there's just so many barriers, even myself, when I try to get an appointment somewhere to do something, it's like jumping through hoops.
Yes.
Right. And staying on hold for however long. And then you got to talk to the insurance company. So we get it. And so that's another piece that we're trying to figure out is, what are the things that actually matter to people. One is like, how am I seeing my doctor? Who's my doctor? Where are they? And then also, when I have this disorder, where are the resources? And making sure that those resources are distributed appropriately. Because sometimes they get like stuck, right? They get stuck in certain hospitals and stuck in certain communities, and you just don't even know. Sometimes there are resources that can be helpful for you. And so really just trying to take those resources out of the silos and get them into the community and just, equitably distributed.
I love your advocacy. I love it. I love your advocacy. I absolutely love it. And hopefully we'll continue to have these conversations. I'm hoping that you will come back and grace us some more with your knowledge.
Definitely. Yeah, let me know.
I will. Yeah, I will. And I will definitely, for people who are looking to contact you, the information will be in the description of this video as well. And if you have any further questions, I will send you to the Instagram, send you to the website, just in case you lost the information. It is never a problem. I'm really excited about this, and I'm excited that we're finally having these conversations for our community. Finally, we've gotten to this stage. So I'm excited as to just where we're going in medicine. It's always great to have another fellow 2%er on the couch. We're still hoping to increase these numbers. Right?
Definitely. We need
Right?
more of us.
Right. But we definitely are out there. We're doing the hard work. And I am Dr. T, the hand behind the handle of Healthy Bum Club right here on YouTube and HealthyBum.Club on Instagram. We thank you for joining us. If you have questions, hit us up in the comments. I will get your questions to her and I will facilitate the response. We thank you guys for joining us, and we hope to see y'all in the next episode.
Yes. And thank you for everything that you're doing and the movement that you're creating. Really appreciate it.
This is Dr. T, just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.